Friends, chronic organic erectile failure or erectile dysfunction that we call as impotence, where a man is continued agonized by failure of the therapy that he is attempting with his therapist, with his physicians and doctors. It's quite a desperate kind of a situation. That means refractory erectile dysfunction of the kind which mature men face in the 30s, 40s to 60s, 70s could have a reason. And the commonest reasons are uncontrolled and long-standing diabetes. The commonest reasons are smoking of long-standing, which brings about the microangiopathy and the microvascular changes in the corpora cavernosa. The commonest reasons are neurovascular disease and neurological diseases where there is a nerve injury or a nerve involvement, like the commonly performed radical robotic prostatectomy where the prostate cancer has been completely cleared. But because the nerves were involved, because the pelvic area was involved, the nerves could possibly be damaged or the nerves could have been involved. So these patients develop a new onset, progressive, chronic erectile failure which almost cannot be treated by any medical management or an injectable therapy or a vacuum erection device. The penile rehabilitation in such chronic organic erectile failure is almost a failure and they don't get a result. So they are agonized. They continue searching for a result and the result doesn't come in. Today in 2021, we have a blessing in disguise in terms of the next generation malleable prosthesis called the TACTRA. The TACTRA happens to be the next generation malleable prosthesis and a promise for the future for all mature men who are cases of erectile failure across the world. Back in India that we have it today and we're implanting it here at the Kokilabin Dhirubhai Ambani Hospital, I understand that this is an important awareness drive for all men with erectile dysfunction. Erectile dysfunction which cannot be managed, which is a chronic erectile failure resulting from various organic diseases, which actually happens to become an indication for an implantation surgery. Today, a malleable prosthesis of the virtuous kind that we have in India and the one which we have recently created out of generations of hard work scientifically, which Boston Scientific has got us to India, happens to be a new promise that can be imparted to the society to men who deserve it. So the men who deserve it are the diabetic men who don't have any erectile function or failed completely in the background of a great libido that they want to perform. Patients who have been smokers are an add-on trouble, which I have been seeing quite chronically in our outpatient department who walk in, whom we work up and finally find that a medical therapy or an injectable therapy or a therapy of a lesser kind does not work. The neurological cases, the vascular cases, the various kinds of hyperlipidemics and very young men, various injuries of the pelvis, injuries where there have been road traffic accidents and various kinds of traumas and prolonged pelvic surgeries and various kinds of nerve involvements. Finally, are the cases whom we have been implanting malleable penile prosthesis. The malleable penile prosthesis of the kind that is available today, the TACTRA, is very close to a natural feel both for the patient and the partner, which means that the partner and the patient feel the very important aspect of natural feel. What do we promise? We promise that there is no loss of sensations. There is no problem with the ejaculation. So malleable penile prosthesis does not interfere with the sensibility of the organ and the ejaculation components. It is actually giving you a capability and emotional health and a physical health out of the agony which has been born as a result of the disease by giving you a concealment of the kind that you deserve. Concealment that you desire because this is a malleable prosthesis. You can actually turn it around, you can conceal it and it has got that kind of a wonderful memory which has been tested time and again to possibly last 10,000 times of bend or maybe 10 years plus of erectile function without any incapability. It's available as a pair of cylinders as a sterile component for a single use. And to show it to you today that's available, it's available as the components which I show you today. So this is a semi-rigid silicone double layer with a very wonderful mold which could be going into the corpora cavernosa on both sides of the male organ, which would be implanted by a very small incision at the penoscrotal junction. And as these implants happen in a very sterile environment with your urologist, your andrologist looking at not developing an infection for you, in which he has worked very hard to look at your urine cultures, looking at a very sterile environment, antibiotic cover, the entire sterile environment in which he normally operates such cases around, that we do it here at Kokilabin Hospital. This will be implanted for the function that you deserve and desire. So this implantation happens to be the new era find which actually will take you to the next level. It comes in 3 different sizes and the sizes are then chosen by us as to which side which we implant, which means that we keep all the 3 sizes ready for the measurements which you do preoperatively and intraoperatively, and then define the actual size required for you to last a lifetime. The capability of this is brought about directly by the inner nitinol core, which is actually a wired nitinol core over which the two layers of cylinders or silicon implants are created as a very sterile implant which is supplied from the Boston Scientific. It has a memory where it allows a very natural concealment after the performance is over. Therefore, a male who would perform would position it for his capability with his partner. He could be able to keep it as long as it wants to be desired to bring about a capability for both the partners to a near completion of the act. And once that is completed, he could actually bend his organ and conceal it quite naturally. So a natural feel without loss of sensibility, loss of ejaculation, keeping your components of capability that you have been agonized and not been able to perform is a boon that possibly was never there. We have been implanting malleable penile prosthesis in India and we have had wonderful results. We climbed the next level on people who deserve it to have the Ferrari on Indian roads, the kind of a capable device which actually is coming around. So for an awareness drive for all men who actually have in a case of erectile dysfunction of the chronic organic kind, of the kind of indications that I just enlisted at Kokilaben Hospital, this is the kind of patient who would deserve to get a proper penile implant, which could then be an implant surgery for him towards a cure for a refractory erectile failure or refractory erectile dysfunction, which he could not get sorted out with therapies that was being given. Friends, it's time for this kind of an awareness drive to reach to men who have been failures, and you happen to be an ambassador to this subject, which actually agonizes men, where men don't know whom to go to, what kind of treatment to seek, and many of them are actually lost their direction into what treatment it goes. And when do have lost that? They've lost in the most mature years of life. It's time to give them back their youth and their capability, and therefore, today, TACTRA stands very tall as a malleable prosthesis, as a next generation capable device to bring about an emotional and a physical health to him and to his partner, and to make it capable that was always missing. A wonderful device that in implants that we have seen today, it feels wonderful to be able to give people the cure that we were aiming for. Friends, thank you so much for this.